Matkar, sir.
Yeah, we'll start. Thank you.
Good evening, everyone. Respected Dr. Matkar, sir, President of the Indian Psychiatric Society Southzone Branch. Chief guest, Dr. B N Gangadhar, sir.
1 minute, sir. I hope they've started the recording.
It's a recording.
Yeah.
Start.
Yeah.
Chief guest, Dr. B N Gangadhar, sir. Guest of honor, Dr. Pratima Murthy, madam. Vice President, Dr. Umashankar, sir. Secretary, Dr. Lokeswara Reddy. Other office bearers and EC members of IPS Southzone Branch. Dr. Basavanagowdappa, sir. Dean of JSS Medical College, Mysore. Dr. Mohan Isaac, sir. Professor of Psychiatry at the University of Western Australia. Members of IPS Southzone, my seniors, researchers, and dear friends. We welcome you all on behalf of IPS Southzonal Branch. It is indeed a proud moment for all of us to present the thematic issue of the Indian Journal of Psychological Medicine, titled Academic Psychiatry. This unique and prestigious initiative by the IPS Southzone Branch marks a significant milestone as we unveil what we humbly believe, to the best of our knowledge, to be the first dedicated journal issue which is related to medical education pertaining to psychiatry from this part of the globe at least. So we are really we feel very proud in that. We extend our heartful gratitude to Matkar sir and our esteemed office bearers for this for their unwavering support. Their dedication has been instrumental in bringing this vision to life. At this juncture, we also want to express our deep appreciation to the former editor, Dr. Shahul Amin, for his profound influence on our journal. His invaluable contributions have not only paved the way for our continued advancement, but also inspired us to strive for excellence in our work. And we are just building on what he has done for so many years. We now invite Dr. Kishor, the guest associate editor of this thematic issue, to share his insights. His pioneering work in academic psychiatry has significantly impacted this field in India, and we are grateful for his remarkable contributions. Thank you all for being a part of this momentous occasion. Your presence here today means the world to us. Thank you.
Thank you, sir. And it's indeed a privilege to be on the platform. With respect to all seniors in this platform, dignitaries and colleagues from various institutions and across India and world who have come. First and foremost, September is a month of teachers. Although we might have moved by a couple of days, it is our duty to pay the respect to all the psychiatry teachers and teachers in particular, because these are the people who are the foundation for the society. As long as we empower the teachers, they are going to bring qualitative change in every field. So the Indian Teachers of Psychiatry, which is a platform for all the psychiatry teachers in India to come together and see what small changes can be done in this field, which will have huge impact in the healthcare services of India. This is one of the areas which has been neglected, primarily because our whole focus is in what way we can deliver services to the public health. We have not looked at where we can enhance the quality, whether at the undergraduate, postgraduate, and super specialty. So it is important that we pay our due focus for the psychiatrists and empower them, and thereby make some changes. In this regard, I'm delighted that the Indian Psychiatry Society Southzone Branch, led by Dr. Abhay Matkar, as the president, in 2018, he made a platform for postgraduate teachers in Karnataka. And amazing insight and vision Dr. Rajshekhar Bipeta had immediately after he took over as the editor. It is his vision that we should come out with a special edition. And when we floated this idea, we were looking at how people will contribute. To our surprise, from Kashmir to Kanyakumari, all psychiatry fraternity came together and they brought out some of the most insightful work they have been doing at MBBS level, postgraduate level, and the super specialty. So it is in this background we should look at the inauguration and circulation of this issue. It's very special for a general journal focusing exclusively on academic psychiatry. We are among the world's largest institution which produces large number of doctors, large number of specialists. And now we should take this step forward where we bring real insight from what qualitative changes can happen at undergraduate, postgraduate, and super specialty level. So I believe coming together of all, from the National Medical Commission chairperson to the director of NIMHANS, from the every aspect of Indian Psychiatric Society, Southzone branch, Professor Mohan Isaac from University of Australia, and Dr. H. Basavanagowdappa, who has been lead of the medical education at JSS and is known for his passionate teaching and research for almost 2 decades. So a diverse group of people coming together on a platform is phenomenal. I hope this will also be a forerunner for other journals to imitate and follow these things. So I believe at the end that every psychiatry teacher, a medical teacher, can do immensely good work, irrespective of the number of students we are going to interact, and try really hard to bring qualitative change in their skills. With this, I hand over to Dr. Rajshekhar Bipeta, and I'm really thankful for giving me opportunity to lead academic psychiatry, even though I had no background on such work previously. Thank you so much.
Thank you, Dr. Kishor. Now I request Dr. Abhay Matkar, sir, to give his presidential remarks.
Good evening, everybody. At the onset, I would like to welcome Dr. B N G sir, Dr. Pratima Murthy, Dr. Mohan Isaac, and Dr. Basavanagowda, and all the seniors, my EC members, who have joined in this phenomenal feat, which has never occurred in the history of Indian psychiatry. My accolades to Dr. Kishor, Dr. Rajshekhar, and his entire team, who have done such an exceptional job in getting some article papers in terms of training towards to undergraduates and postgraduates. We always feel that psychiatry and psychiatric teaching has continued to be neglected in our mainstream learning. So if we are able to generate some interest amongst ourselves first, how best we can navigate through the nuances of teaching and learning, I'm sure the students in the coming years would be benefited. I am in the long run, obviously, all this is going to percolate into better care for our needy society. My accolades, my congratulations to Kishor and Rajshekhar again, and of course, Dr. Shaul Amin, who has initiated this, and their entire team for having come together and brought about this presentation. And I'm sure this will go a long way, not only for our zone, but to other zones and maybe across the globe too. My best wishes to all of you. Thank you once again.
Thank you, Matkar, sir, for those encouraging remarks. Now I request the Vice President, Dr. M. Umashankar, sir, to speak few words.
Good evening, all of you. First, our President, Dr. Abhay Matkar, sir, and our today's Chief Guest, Dr. B N Gangadhar, sir, and Pratima Murthy, madam, and Mohan Isaac, sir, and our office bearers. And today is an important day for us, Psychiatric Society, because we are definitely always we are looking forward for the betterment and the society. This will help to educate the many of the undergraduates and postgraduates. And work done by behind this is Dr. Rajshekhar and other team members. So I congratulate all of you for doing the very wonderful job. And this will be helping in the future. Thank you for giving the question. Thank you, Rajshekhar.
Thank you, Umashankar, sir, for those encouragement. Now we request actually Dr. Gangadhar, sir, who is the chief guest, who is the chairman of National Medical Commission, New Delhi, is currently taking a flight. So, sir has sent a video recording, and we'll now request Dr. Kishor to play that.
I'm very happy that the special edition of the Indian Journal of Psychological Medicine is being released. My sincere apologies that I am not able to meet in the live program, although virtual. However, I must thank the organizers for letting me speak a few words that will be used in the inauguration. The editor of the Indian of Psychological Medicine and the other lead people who have made this possible deserve a great applause and ultimate congratulations. The focus, amongst many other things, is on the education and structuring the training in psychiatry to both undergraduate and postgraduate trainees. It's a welcome move by the Indian Psychiatric Society, JSS Medical College in particular, having made this possible, the Department of Psychiatry of the JSS College. Although there are several issues that I may want to flag here, but I will limit it to one point which can be considered by psychiatrists at large, and also medical fraternity and the education system at large. Even again, I get a call that psychiatry should be a separate paper in MBBS curriculum. The pros and cons of which is not the subject of discussion right now, but what I want to say is that the training in psychiatry should become integrated with the other mainstream subjects in medical education, from anatomy to the last paper in pediatrics. At every stage, there is a scope for representing one aspect of psychiatry. All universities which are structuring their examinations could consider this part, that perhaps in each paper there is the possibility of having a short notes which has direct or indirect bearing on the mental health or psychiatry related subject. For example, the amygdala and its anatomy, or the frontal lobe and its anatomy in the paper of anatomy would have a relevance. Of course, those subjects have a relevance to psychiatry. And you can go on giving such explanations. The dopamine metabolism, dopamine transmission in biochemistry, or perhaps cortisol levels in the blood related to stress, again, would come in the biochemistry. And you can go on and on and on. Every subject has a component which can be represented in terms of mental health, which is best taught by their own teachers who are teaching that subject. Of course, psychiatry, there is a posting, there is a training, there is also an internship that, of course, will consolidate all these education, being a very short exposure in psychiatry, putting all these things together by the lone psychiatrist would perhaps be a challenge. But of course, we know that in most primary care settings, close to about a quarter of them would have a psychiatric disorder, and a little more than half of the chronic mental disorders would have a comorbid psychiatric disorder, chronic medical disorders, who are coming to physicians or other categories of specialists would have a comorbid psychiatric diagnosis. So it is imperative, and it's also very useful in clinical practice for all physicians of different specialities to know about mental health. And of course, they in turn emphasizing and teaching that component of the clinical presentations to psychiatry residents, or even more importantly, the undergraduate students, can make psychiatry well integrated with primary care, and the MBBS students will come out with better competence with relates to mental health practice once they pass out MBBS. So I'm sure this is something that in all the medical colleges, our psychiatry colleagues would perhaps work with the other specialty groups of people, and we may have to talk about integrated education of mental health in MBBS curriculum. This is something that we perhaps have to start speaking about in the medical colleges, and the other specialty groups where the postings are contact for the PPS students is even longer, they will probably be able to also emphasize psychiatry in addition to the psychiatry postings that they have. In fact, by this process, many undergraduate students may be motivated to compete for psychiatry as a postgraduate qualification as well. So it has a multivariated benefit, and I'm sure Indian Psychiatric Society, working with other professional bodies and all the medical college teachers who are there in Indian Psychiatric Society, working with the other medical departments, clinical departments, other basic science departments in their colleges, can make psychiatry even more versatile, even more visible, even more lively to learn from all the undergraduate students. Wish you all the best. Thank you for inviting me to be a guest speaker or the person who is inaugurating this journal and releasing it to the psychiatric fraternity. Thank you and wish you all the best and happy Dasera.
Thank you, Gangadhar sir, for those extremely useful comments and remarks. Yeah, sir was basically talking about the competency-based medical education, especially with stresses on the vertical integration and how psychiatry should be integrated across different levels. Thank you so much, sir. So now sir is not there. So on behalf of sir, that journal will be released. Yeah. Okay, Kishor, can we show the soft copy? So the first one is the front cover, and this is the contents, the table, contents with all the, we have 23 articles in this particular issue of the journal. So it's around 165 pages. So we have a lot of viewpoints. The guest editorial is written by Dr. Shehan William from Sri Lanka. He's an authority in medical education in relation to psychiatry. And we have a lot of viewpoints and original articles, few case reports, Thank you. Now we'll show, yeah, Dr. Kishor, please.
These are the cover page articles which have looked in very interesting areas. This is the complete review of the psychiatry educational research which has been happening in India. Then there is why students do not turn up to the teaching in psychiatry, and also what kind of felt needs are there in institution of national importance. So these are the cover articles which have been chosen as the best among, although we have found every article is deeply perspective and it can be translated in each institution at every phase, whether it is CBME, whether it is super specialty courses. I think all such articles have been integrated in this issue. Over to you, sir.
Thank you, Dr. Kishor. Now we request the guest of honor, Dr. Pratima Murthy, madam, to deliver her brief address. Thank you, madam.
Good evening, everybody. Absolute pleasure to be here on this occasion. It's the month of Teachers' Day. So let me first start off by wishing my own teachers. Of course, Dr. Gangadhar is not here, but Professor Mohan Isaac is around. And he's been a great teacher to many of us, a great mentor. And I think it's very, momentous that we should actually be having him with us today. I also want to take this opportunity to first congratulate our branch for bringing this out, and particularly the leadership that Dr. Rajshekhar Bipeta has given us, and the enthusiasm shown by Dr. Kishor to make sure that there is this whole issue dedicated to academic psychiatry. I mean, it's quite a difficult thing to believe that you have 23 articles discussing this issue. So I think it's a great moment for Indian psychiatry, and I wanted to also congratulate the office bearers of who have been involved and who are present here today, and of course JSS Medical College, where Dr. Kishor works, for actually supporting this event so unconditionally over the years. While we talk about psychiatric training and what needs to be done, one thing that struck me was something that Dr. Kishore just mentioned: why trainees do not attend classes. So I've been increasingly become aware that this is not confined to any particular specialty, but there is a general diffidence for students to attend classes. And apparently, even in the undergraduate scenario, this is quite common. So I think it's very important to ask ourselves how indeed we can improve training. I do know that there are some chapters in this particular volume that discuss the issue of, for example, the way units work, the advantages and disadvantages of the unit system, the kind of entrance examinations and exit examinations. But most importantly, I think one should focus on the quality of training. Several times I think Dr. Mohan Isaac, I and several others have been involved with suggesting what should be the training curriculum. How do you make sure that at the end of the day, you don't just produce a safe psychiatrist, but also a psychiatrist who kind of understands the context in which psychiatry works? For example, has a greater understanding of the humanities, of the ecology in which psychiatric problems occur, so that one can be more empathetic to both patients as well as their family members. So, excuse me. So, but we also know that there have been huge advantages in technology, in imaging, in so many other basic sciences in the understanding of psychiatry. So, I think understanding all of this is going to become very important. So, the psychiatrist of the future, pardon me, I have a very bad cough. So, psychiatrists of the future and should not only just be aware of the knowledge in core psychiatry. Just give me a second, please. But also aware of the advances in the field, so that they can use it. I mean, just take the example, for example, of artificial intelligence. If we finally have, for example, a whole lot of case records which help us prognosticate and to decide what kind of decisions doctors need to make, the psychiatrist needs to be abreast of that. But in addition to this kind of technology, what psychiatrists should not lose sight of is empathy and compassion. And how do you then create that kind of context in which psychiatrists actually learn empathy? That can only be done by teachers of psychiatry. And therefore, we're hoping that what Dr. Kishor under Dr. Mohan Isaac's stewardship has started, which is the training of young psychiatrists, we hope that we'll be able to do it in a more organized manner, so that psychiatrists will not only just become effective clinicians, they will become compassionate and ethical practitioners, but more importantly, they will really make sure that they take their patients along with them and show the same kind of compassion to carers whom we all know find it very, very difficult and challenging to care for people with psychiatric disorders. At the same time, we also know that stress is something that's hugely a big problem everywhere. We all know it's being discussed, and particularly in stressful subjects, this becomes very much more important. So I hope the training will also focus on how to make the whole 3 years of training and subsequent times meaningful for young psychiatrists. I'm going to stop here. I don't think my voice is going to allow me to go on any further, but hearty congratulations to everyone and all the very best. I hope that whatever is contained in these volumes, in these chapters, will finally be read by everybody and used in altering the curriculum in the days ahead. Thank you very much.
Thank you, Pratima madam, for being with us and for such insightful speech. and we are very thankful to you. Despite being ill, not well, you have been with us. Thank you so much,
Teacher.
madam. Yeah, okay, thank you, madam. Now we request Dr. Basavanagowdappa, who is the Dean and Principal of JSS Medical College, JSSAHER Mysore, and Chairman of JSSMC Medical Education Unit, to present his lecture. Thank you so much, sir.
Good evening to everybody. At the outset, I thank the entire team of Indian Psychiatry Society Southzone, office-based the editorial board of the Indian Journal of Psychological Medicine, as well as the wonderful effort that is done by Kishor and his team for putting it together to bring out wonderful issue of academic psychiatry issue, Indian Journal of Psychological Medicine. The present era, when compared to what we were 3 decades back when students, the intentions and training mechanisms were only directed to give knowledge and enough to diagnose a disease and be a competent clinician handle the disease. And the opportunity to learn the advances in research profession in medicine was limited. Later on, it got changed, and currently, even NMC, we are thankful that it is driving the research inculcation from the UG level to PG level to the clinician level. So, with that has to happen, it is a wonderful thing that can happen to make people involved in medical education, learners as well as teachers, to know what is happening, and the effective research communication is very, very important. And that can happen only through the quality journal of this kind, number one. Number two, the kind of delivery of academics through the design curriculum has to keep on changing to the contemporary challenges to be overcome, matching and aligning with the expectations of the stakeholders, that is learner, the teacher, and the society. And the address of the curriculum, which should be based on or designed on the wonderful article input that has been possibly exhibited in this issue. And hopefully, if that can be circulated to every medical college, and they can relook into their curriculum, redesign, especially psychological medicine, both at UG level and PG level. Having said that, as mentioned by our chairman of NMC in his address by Dr. B N Gangadhar, it is necessary for every specialty to come together and try to put up an issue in their particular specialty to bring out an issue of this kind, like dedicated issue for their specialty concern in curricular designing or medical education component related to the specialty. If that can happen and if they all can be incorporated, we can go beyond what is CBME curriculum that is driven by NMC. Hoping that to happen, I appreciate the entire editorial board, the South Indian Psychiatric Society office bearers, and a special efforts taken by Dr. Kishor, and blessings that is there from our chairman of NMC by Gangadhar, as well as the director of NIMHANS, Pratima Murthy. With all these efforts, the medical education should get further streamlined, and curriculum has to be relooked at regular interval, and upgradation can happen both in designing the curriculum, delivering it properly, monitoring it, and implementing it, evaluation process, so that we produce the manpower with a greater knowledge, who can overcome the contemporary challenges. I thank everyone for this opportunity given for me to address this issue. All the best for such wonderful efforts. We appreciate everybody's efforts, and thank you so much.
Thank you, sir, for that wonderful lecture. Now I request Dr. Mohan Isaac, who is the Professor of Psychiatry at Department of Psychiatry, University of Western Australia, to give his presentation.
Thank you very much, Dr. Rajshekhar Bipeta. Dr. Gangadhar, Chair of the National Academy, Medical Academy, is not there with us. We listen to him. Dr. Basavanagowdappa, Dean and Principal of Medical College. Dr. Pratima Murthy, Director, NIMHANS. Dr. the president, the vice president, and the other office bearers of the Indian Psychiatric Society Southzone, and all the distinguished participants. I can be a little relaxed because Kishor told me that the whole program should end in 1 hour. Now I find that after me, there are only 2 more speakers. Most of the other speakers have completed, and we are only at 7 o'clock now. Initially, I was a little anxious. Oh, how can I say all that I want to say in just 5 minutes? But now I am a bit more relaxed. I will take a little more time. Of course, I will not exceed my time, and Kishore has set up 1 hour for this program. So I would still be very much within the time. I'm so delighted to participate in this program because it's a release of a special issue of Indian Journal of Psychological Medicine, exclusively devoted to academic psychiatry and the teaching of psychiatry, medical education, etc. And as Pratima highlighted, we just heard that there are 23 papers, all on different aspects of psychiatry. The topic given to me by Kishore is thrust areas in psychiatry education research. But before I go into the thrust areas, I must give a little background to what this area of research is. Now, we all know about various other areas of research which we are very familiar with. I mean, many of us are guides of people who do MD thesis. We have to, design topics and guide them for research. But I don't think any of us are very well versed in psychiatry education research. What is this psychiatry education research? And what are the thrust areas? So I will say a few words about my own interest in this area, and then tell you what is psychiatry education research. And of course, I will not be able to tell you all the thrust areas, but I'll give you some link or references where you will get a lot of information about various thrust areas. Now, earlier on, it was mentioned that one of the papers in this particular issue, and which Dr. Pratima also highlighted, is that why students don't attend classes. And it is it's a very pertinent question. It's not only undergraduates, even postgraduates. For several years, when I was the chair of the Department of Psychiatry, we are only talking about postgraduates. And those days, we did not have so many postgraduates as they have now in NIMHANS. It was maybe 15 DPM, first year, second year, 4 or 8 MD students, etc. And they used to be 8 to 9 lectures before they go for the 9 o'clock clinical work. And always students wanted these lectures. So we would, the faculty would very carefully put up teaching program, lecture programs, etc. And one of the things I had to frequently deal with was senior faculty coming to me at 8:15, saying that, I was there at the classroom at 8 o'clock. Nobody was there. 8:05, 1 or 2 persons came up, and then we waited, and there were only 1 or 2 persons. Now, what do I do? So this problem of students not attending classes is a big problem. Undergraduate, postgraduate level. I'm eager to read that paper. Somebody has done some research on this. But I must tell you my own experience and my interest in this psychiatry education or medical personnel began sometime in the mid-1980s when we were developing the community mental health program. The thrust of the community mental health program, today the district mental health program, which is, the Government of India, Ministry of Health proudly says that it is all in 700 districts of the country, etc. But the thrust of that is making primary care personnel deliver basic mental health care by training multipurpose health workers and doctors. So I used to initially in Anekal, Solur, and then many other places, and later on in Bellary district, train primary care doctors who are all PhD doctors. And that is when and of course, you had to train them in 1 or 2 weeks. They are not terribly interested. They are busy people. But the success or failure of the mental health program would depend on how these doctors, would pick up the thing. And that is when I started looking at adult learning methods. I learned about the difference between pedagogy and andragogy. And the crux of the problem really is that these medical students and postgraduates are all adults, but we treat them like children, like high school, 9 standards, 10 standard. We want all of them to come and sit in the class, silently and be passive learners. So one of the important things which ultimately in India we are now bringing about, that is by the competency-based medical education, is bringing in andragogy, that is active learning formats, active learning methods into our curriculum and our training, etc. It has taken a long time. I mean, Western countries moved from pedagogy to andragogy in medical education at least 10, 15, 20 years ago. And many countries are in the process of doing that. In India, we are very new. It was only in 3 or 4 years ago that we introduced the competency-based medical education. So that is all about adult learning methods, etc. Now, this is my interest and background, and subsequently in the past few years, I've been working actively with a set of very, very passionate, dynamic youngsters. Some of them are in the audience, Kishor and Vinay and many others, and many other people who have also undergone the scholarship in this teaching program, some of whom will be talking also, and I find many of them in the audience. Now this is my interest, and this is the way this program is going on. And Dr. Pratima Murthy, director, mentioned that this, teaching skills enhancement for psychiatric teachers would become a more organized program, not just by the ITOP, but in a more regular manner in the coming years. I think this is very important. Now, let me say a few words about the topic given to me by Kishor, that is trust areas in psychiatric education. Now, medical education research is an important area of research, which most of us don't accept. Is it important? Is it research at all? Is there an area called medical education research? Of course, there is. And one sub group of that is psychiatry education research, which is very, very new in this field. Of course, if you talk to physicians and surgeons and maybe even neurologists, they would have more experience, or there would be people who were interested in teaching their postgraduates, their undergraduates about their specialty subject. But psychiatrists are, I think, the most recent to join this. And psychiatry education research is an important area. Now, mentioning this, I must refer all the audience to two particular papers. I'll just tell you the name and the title of the papers. The first paper is a paper titled Psychiatric Education Research, the Birth and Development of a New Field. This is, of course, a paper published in the Canadian Medical Journal, Canadian Psychiatric Journal. It's an editorial. So this is in 2008. So 2008, at least in Canada, United States, etc., the birth of psychiatry education research began, and this is a kind of a guest editorial. But I must tell you a little bit about the author who has written this editorial. It is Professor Brian Hodges, who himself is a medical education, professor of medical education. He works in Ottawa. But my own interest about his paper and his work began many years ago. I told you about training primary care doctors in Anekal, Solur, in various PHCs of Bellary districts, etc. And I used to think, is anybody else doing all this? And sometime in 2001, there was this paper by Brian Hodges, and that is when I first knew about him and read a paper. And this paper was actually about, it's a very interesting kind of paper. The title of that paper was Improving the Psychiatric Knowledge, Skills and Attitudes of Primary Care Physicians, 1950 to 2000, a review. 50 years, he reviewed all efforts by psychiatrists training primary care doctors. And of course, there are lots of learning. I'm not going to talk about what he said. This was published in the American Journal of Psychiatry in 2001. Brian Hodges. Please do read up. It's a 1.5 pages editorial in the Canadian Journal of Psychiatry, which is free access, wherein he talks about psychiatry education research, the birth and development of a new field. Okay. Now, the second paper I would like to highlight here, and that is about the thrust areas in psychiatric education research. And that paper is titled Preparing Psychiatrists to Do Education Research. This is in the journal Academic Psychiatry. Now, I mentioned earlier that medical education research as well as psychiatry education research are new areas. But let me reassure you that there are many journals which have started in the late 1990s and 2000s, which are now focusing only on medical education research. There is academic medicine. Of course, academic psychiatry is a journal which is exclusively publishing papers about, very much like the special issue that we have now brought about of the Indian Journal of Psychological Medicine. Academic psychiatry is a journal which is exclusively devoted to education, training issues, etc., in psychiatric research. And there is, of course, the BMC medical education. So, for people taking up psychiatry education research, and I'm sure many in the audience will get inspired to do some of the researches, some of the topics which I'll tell you a little later on. And there are various channels for publication. And to stimulate you further, I must also tell you that the Karolinska Institute has instituted since I think 2000 or early 2000 a special prize for research in medical education. It is called KIPRIME, KIPRIME, Karolinska Institute Prize for Research in Medical Education. It is 100,000 euros. So I would hope that some of you now would get interested in doing psychiatry education research. There is a paper in this journal I noticed, while it was being inaugurated, that the must enrich grant of ITOP. Many people have done research in psychiatric education, and it's a summation or summary of that. So for people who are going to take up research in psychiatric education, various aspects, there are numerous channels for publication, not only the Indian Journal of Psychological Medicine, but academic psychiatry, medical education, BMC medical education, etc. And of course, for those very innovative people, you could also perhaps be nominated for the Karolinska Institute Prize on Research in Medical Education. Okay. Now, what are the thrust areas for us to do research? There's so many that I don't think there would be. See, we have just taken on competency-based medical education. I do not know whether many papers have been published, not only by psychiatrists, but even other branches, other specialists about how competency-based medical education is being implemented in India. The few psychiatric conferences, IPS and zonal branches, state branches, which I have attended in the past 1 or 2 years, I have heard numerous problems by learners as well as teachers. Learners, not many of them attend, and even if they attend, they are not very bold enough to get up and talk about the problems. But many teachers, many senior faculty have been talking about the various kinds of obstacles, various kinds of problems in introducing active learning formats, andragogic formats in teaching undergraduates as well as postgraduates. I think that itself opens up numerous areas about studying what they are, how they can be overcome, etc., etc. There are cost effectiveness issues, there are resources issues, there are time issues. While andragogy is a better method, both for the learner as well as the educator, there is greater investment of time required, there's greater investment of resources. How are we doing all this in India? And, we have Kishor highlighted We are the largest. I think we have even overtaken China in having the largest number of medical students every year, largest number of postgraduates. So I think it is a responsibility for us in India to come out with all these research areas. So I would end by requesting and appealing everybody in this audience to read these two papers. First is about Brian Hodges' editorial on psychiatry education research, the birth and development of a new field, the guest editorial in the Canadian Journal of Psychiatry, 2008. And the other paper is about preparing psychiatrists to do education research. It's an extensive paper in uh, uh, academic psychiatry, all the thrust areas on different variables, student variables, teacher variables, context variables, instructional or curricular variables, etc. Plus the cost effectiveness issues. Numerous, it's a long list of areas where people can do research. And I would encourage some of you at least to take up, and also encourage some of the early career psychiatrists to take up some of these research areas. I would stop here. Thank you very much, Dr. Rajshekhar and the office bearers of the IPS Southzone, as well as Kishor and other active members of the ITOP for giving me this opportunity to take little longer time than all other people. Thank you very much for a patient listen. Back to you, Rajshekhar.
Yes.
Thank you, Mohan sir.
Thank you, sir.
It is always a privilege to listen to you, and like you have done so much of work in this field. We are really very honored to listen to you. Now I request Dr. Arghya Pal, who is Assistant Professor of Psychiatry from AIIMS Kalyani, to go ahead with his presentation.
Thank you, sir, for this opportunity. I have prepared a small presentation, so I will ask for permission to share my screen. I hope my screen is visible.
Yeah, it is.
Thank you, sir. Thank you, Rajshekhar sir. Thank you, Kishor sir, for this wonderful opportunity for me to present my research. And I will also seek the blessings of Gangadhar sir and all the office bearer of IPS Southzone. I'll begin with the presentation. The topic that was allotted to me was psychiatry teaching in institutions of national importance. And this was a research which actually was conveyed to me by Kishor sir that we should embark on a research like this, where we should be looking at the issues that are very pertinent to the institutions of national importance. So in medical education in India, as all of you know, can broadly classified in medical institutions, medical colleges which are under the ambit of National Medical Commission, and institutions of national importance which are autonomous. And there are a small subset of institutions which are actually both. They are institutions of national importance, but they remain under the ambit of the National Medical Commission. But what National Medical Commission has done is that they have introduced a curriculum-based, competency-based medical education, as Mohan Isaac just mentioned. And in order to help with the implementation, there has been some implementation of basic courses and curriculum implementation support programs. And all of these programs are mandatory in NMC colleges, and mostly this has been perceived to be very generic for teachers of psychiatry. This is an image that I've taken from the issue that has been just published, and psychiatric teaching in India can be considered classified as in this way. There is the undergraduate programs running in India. There are postgraduate programs which are usually popular, and there is super specialty programs in terms of fellowships and DMs, which are also highly popular, sought after programs in India. All of these programs are taught in both the institutions of national importance and also in the NMC controlled colleges. But we felt that in the only research that has been done on this field was a landmark research done by Kishor and his team, and very prestigious teachers are there in this paper. And it was reported that there was a substantial need for further training. That was a felt need among the teachers. This was a survey done amongst psychiatric teachers in Karnataka, and the figures are very high. And this led us to think that probably there needs to be a similar effort done in the institutions of national importance. And that is why the current paper that we are talking about was conceptualized. And these are all my co-authors, Dr. Arghya from IIMS Bhubaneswar, Dr. Shantanu from IIMS Deoghar, Dr. Nishtha is from IIMS New Delhi, Dr. Snehal is from IIMS Bhopal, Vinay sir is all known to you, sir is from Aditya Engineering Institute of Medical Sciences, and Kishor sir is very well known to all of you. What we did in this study is that we designed an online survey which was sent across to the target respondents that we were looking for. So we used a snowballing in our approach. We had sent out individual invitations, and also we had posted on groups. This was an open survey. It was not very long, around 10 questions per page, and a 2-page questionnaire, which according to us took around 10 to 15 minutes to respond. The auto remains same for most, and the face validity of this questionnaire was assessed by 2 professors who are experienced in this field. The inclusion for institutions we chose, the institutions of national importance, as has been defined by the Department of Higher Education, Ministry of Education, Government of India. But we only chose institutions which are autonomous and outside the purview of schools. And the respondents were faculty members and senior residents. These are the questionnaires, and the questionnaires are basically had 2 parts. There were some of the questions were mandatory and they were closed-ended. They were either short answer or multiple choice questionnaires. And there were a few questions which are open-ended, which were long answer type questions, and it was optional. And the mandatory questions were analyzed as quantitative data, and appropriate descriptive and information statistics were employed. For the optional questions, which were long answer type questions, we used a structured tabular approach of thematic analysis for brief texts. And this was a psychiatric maneuver that has been designed by Robinson et al. And the data of this optional questionnaire was reported in terms of the most commonly recurring themes and the frequency of responses received. So we are now going into the results. We had around 55 responses, and in those responses there was a higher number of young psychiatric teachers. So we had around 85% of respondents who were less than 40 years. They were either senior residents or assistant professors, and we had an equal representation from newer INIs and older INIs. So newer INIs were defined as INIs which were in existence for less than 10 years, and older INIs were more than 10 years. So we had an almost equal representation from both kind of INIs. What was very striking to us is that there were around the felt need for training in undergraduate teaching amongst our respondents were around 92%, which was substantial. And the figure for postgraduate teaching was around 69%. And in comparison to that, only 38% had actually received a formal training in medical education technology. When we compared the responses between residents and faculty members, what was also striking is that the felt need between residents and faculty members were comparable. Both had a very substantial high need for training, but actual training has mostly been imparted to faculty members, and residents have been deprived of that. However, residents were willing to pay, and they showed eagerness to receive medical education technology training. When we had compared the responses between institutions of national importance of the newer INIs and older INIs, what we found was that there was a higher number of respondents from the newer INIs who were willing to pay participate in training in UG teaching. And we probably felt that this could be due to the fact that the older INS had a very structured medical education technology program already, but newer INS are still evolving and they need to step up in terms of their capacity to impart medical education technology training. Similarly, the higher number of respondents from older INIs felt that they require training in UG psychiatry. This was a very striking result to us, and probably this requires further research in the later years, so as we can justify what could be the possible reason behind that. This is the analysis that was generated using the thematic analysis for the brief text that we could obtain from the optional questions. And the column on the left actually gives you the major and medical education arose as the most prominent theme with the highest number of responses, followed by teaching skills in psychomotor and affective domain, suicide risk assessment, adult psychiatry, and so on. There were a number of themes that come. And very innovative themes like the role of artificial intelligence in psychiatry also came up as a possible theme where further targeted training for teachers for undergraduate psychiatry. So to discuss, what we found was that there was a substantial need of a training in terms of UG teaching and PG teaching. And these figures were very comparable to the landmark study by Kishor sir et al., where the study was conducted in Karnataka, where there was almost similar kind of numbers that the investigators had obtained. And what was also important for us to understand here is that faculty members, though they are provided more opportunities to train, the felt need for training among residents were also equal. So this is probably a thing that we need to keep in our mind once we are planning for further training initiatives in medical education. The common themes that arose in terms of what were the opportunities of teaching in psychiatry INI is that the teachers felt that there was a freedom to develop and customize their training hours and teaching hours and approaches. They were able to take more structured summative assessment at the end for undergraduate students, and specialized posting in subspecialty is possible very easily. Whereas the challenge is that many felt that the lack of framework in curriculum was there, which hindered their progress. Lack of administrative focus on undergraduate teaching in some of the institutions were reported, and training remains inadequate in the absence of summative assessment in the undergraduate curriculum. This was also reported. So basically, what you can learn from here is that experience from INS Deoghar and INS Rishikesh, where psychiatry is a separate paper as a part of summative assessment. They have those are the areas that can be looked upon and can be replicated. But then there has been alternating viewpoints in terms of whether it's better to be outside the NMC framework or the CBME framework as has been designed by NMC. There were some controversies among various respondents regarding that. So to conclude, as has been mentioned in the study, there is a substantial need for training among teachers of psychiatry in the institutions of national importance. This study provided some insights regarding the opportunity and weaknesses of teaching psychiatry in the INS, and further research on this topic and probably using qualitative design should be planned in the future. Thank you.
Thank you, Dr. Arghya, for that wonderful work. Like, we are really thrilled to have your paper in our thematic issue. Now, with this, we conclude today's session. But before that, we request Dr. Lokeswara Reddy, who is the Honorary General Secretary of IPS Southzone, to give a vote of thanks.
Good evening, everyone. I'm honored to present this vote of thanks. At the outset, I humbly extend my gratitude to our chief guest for today's event, Dr. B N Gangadhar sir. Though sir could not attend today's meeting, his message has added immense value to this event. And we are honored to have Dr. Pratima Murthy Madam, Director of NIMHANS. Thank you, Madam, for sharing your insight and addressing on this event. We thank Dr. H. Basavanagowdappa sir, Dr. Mohan Isaac sir, and Dr. Arghya for their excellent insight in advancing our understanding in this particular area. Our gratitude also goes out to our President, Dr. Abhay Matkar, and Vice President, Dr. Umashankar, for their presence and gracing the occasion. We would like to express our sincere appreciation to Dr. Rajshekhar Bipeta, Editor-in-Chief of IJPM, and Dr. M. Kishor, Guest Associate Editor and Section Editor of Academic Psychiatry, for all the hard work they have done and for sharing these remarks on this thematic issue. We are truly grateful to each one of you for making this event a success with your presence. Lastly, I thank the Sun Pharma for providing the technical support for this particular event. Thank you. Thank you, one and all.
Thank you, Lokeswara. We are really very thankful to all of you, especially to the office bearers of IPS Southzone. It's a big challenge actually to have a program on a weekday, 6 to 7 p.m., where all of us are busy with our private practice and all that. We really thank you from the bottom of heart for being there. Thank you so much.
Thank you.
Thank you. Thank you.
Thank you, sir. Thank you.
Thanks, everybody. Thank you.
Thank you, sir. Thank you, all of you. Thank you, sir.
Thank you.
Thank you, everyone.
Thank you.